What is the cause of degenerative disc disease? Yesterday, I presented the case of a 42-year-old female who presented to my office with neck pain. She's had this neck pain for a number of years, which seemed to start after a car accident. She's had extensive conservative treatment, including physical therapy, dry needling, chiropractic management. She's had multiple injections, and it still is persistent. Her pain is located mostly in her neck and into the shoulder blade. She describes it as an aching and burning type pain, and it seems to be worse when she first wakes up in the morning. Here are the x-rays that I showed of her cervical spine, and what we see is actually pretty well maintained discs, which are the cushions between each of the bones in our spine, with the exception of this, which is the C5 and C6 disc. She has a fair amount of disc degeneration, or where the disc height has actually shrunk down. And we can see right here on the back, there's actually some bone spurring or osteophytes located there. I showed a sagittal MRI that's kind of off to the side to demonstrate these osteophytes that you can see at C5 and C6. The other levels don't seem to have that, and the disc height is pretty well maintained. She has cervical degenerative disc disease of C5 and C6, and she's had exhaustive conservative treatment. She wants something that's going to make her neck pain go away once and for all. She's miserable. In the comment section of the video I posted yesterday of the case presentation, there was a few of you guys that said neck pain is not an indication for surgery, and I'm going to explain why it actually is. You don't have to have radiculopathy or nerve type pain radiating down the arms to be a candidate for surgery. So let's just take a step back and talk about what is degenerative disc disease. Well, let's just talk about what is a disc. Now, I've shown this in many other videos, but the discs in our spine are the squishy things that sit between the bones in our spine, and it allows movement of the neck. The disc is kind of like a jelly donut, and it's got cartilage inside, so it's subjective to any type of injury, just like any type of joint in our body. Just like the car accident that she had that initiated the neck pain. In spine, we like to use a bunch of confusing terms to describe discs. So let's talk about what a degenerative disc is, a bulging disc, a herniated disc, a slip disc, a bone spur. What does all that stuff even mean? Here's a really good picture that describes what each of those words kind of means when we talk about discs. Here's another picture, and you can pause the video to look at those pictures. So a degenerative disc is actually just a disc that's been injured. So why do we call it a disease again? It's not a disease. It's a condition in which a disc that gets injured can deteriorate over time. Now, the disc itself has a lot of water content in it. So when it gets injured, it can actually dry out and start to dehydrate or lose its height. And after a while, that can cause pain. Lucky for this patient, it was really easy to identify the source of her pain because she only had one degenerative disc, and she got relief when she had injections in this region. It didn't last, but it did help. From a diagnostic standpoint, that's really helpful for the surgeon to isolate the source of the pain. Now, in patients with multiple degenerative discs, it can be confusing and it can be challenging to deal with from a surgical perspective. As I've talked about in other videos, I am a big believer in motion preservation. Many of you guys answered spinal fusion, and I do not think that this patient needs a fusion. She's 42. She's active, and we need to maintain the motion of her spine and restore it back to normal height. She's a great candidate for a cervical disc replacement. Here's an animation video that describes how we perform a cervical disc replacement. The surgeon removes the disc and then replaces it with an implant that preserves the natural range of motion of the spine in all planes of movement. This particular implant also allows for a little bit of shock absorption, very much like a native disc. Who exactly is a candidate for a disc replacement? Let's cover that first. Currently in the United States, cervical disc replacement is indicated in degenerative discs of the cervical spine in 1 to 2 levels. It's indicated in patients that are under age 60 and have normal bone density with no other signs of infection or trauma to the bone. They've also had to have failed 6 months of conservative treatment. So in her case, she meets all of those criteria. Basically, we make a small incision on the anterior part of the patient's neck. We go in and remove the bad disc, clean out all the osteophytes or bone spurs, and then put in the disc replacement, which preserves the patient's range of motion. Now, this procedure in my hands takes about 45 minutes for one level, and the patient can go home the day of surgery. They do have some restrictions after surgery, but in 6 to 12 weeks, they're usually back to doing most normal things. And the best part is their pain is gone. Here's our patient's x-rays, and you can see where we remove the bad disc and put in the disc replacement. Here's the before and after, and you can see even the alignment of her spine is better. She is over a year and a half out from surgery and now lives a pain-free life and no headaches. Now, not every patient is a candidate for disc replacement, but if you do have degenerative disc disease, I would make sure to ask your surgeon if they do perform disc replacement, because not every spine surgeon does. It's so important to be your own advocate, and don't be afraid to ask for a second opinion. Stay tuned next week, and I'll go through another case.